For those of us living with chronic fatigue syndrome, every day can feel like an uphill battle. The hallmark symptom of relentless fatigue pervades every aspect of life, making even the simplest tasks feel daunting. Activities that were once taken for granted, like grocery shopping, socializing with friends, or pursuing hobbies, may now seem insurmountable. Chronic fatigue syndrome takes a toll on mental and emotional well-being. Coping with the limitations of the condition can lead to feelings of isolation, guilt, and depression. People with chronic fatigue syndrome struggle to maintain relationships, hold down jobs, or participate in social activities, leading to a sense of disconnection from the world around them. The stigma and skepticism surrounding chronic fatigue syndrome further compound these challenges, and some even dismiss the condition as mere laziness or hypochondria. But if you suffer from chronic fatigue syndrome, you know this isn't true. Despite the many obstacles they face, individuals living with chronic fatigue syndrome demonstrate remarkable resilience and resourcefulness in managing their condition. Learning to pace activities, prioritize tasks, and listen to their bodies becomes essential for conserving energy and preventing symptom exacerbation. Embracing self-care practices such as mindfulness, relaxation techniques, and gentle exercise can help alleviate stress and promote overall well-being. Chronic fatigue syndrome is a complex and debilitating condition characterized by persistent fatigue that cannot be explained by any underlying medical condition. It affects millions of people worldwide, yet it remains one of the most poorly understood and misdiagnosed conditions globally. Despite decades of research, chronic fatigue syndrome continues to present many unanswered questions and challenges. Ongoing studies aim to unravel the underlying mechanisms of the condition, identify biomarkers for diagnosis and prognosis, and develop more effective treatments. Advances in technologies such as functional imaging, genomics, and immunology hold promise for gaining insights into the biological basis and ultimately improving patient outcomes. One of the greatest challenges for individuals with the disorder is obtaining an accurate diagnosis and accessing appropriate treatment. Due to the lack of specific diagnostic tests or biomarkers, chronic fatigue syndrome is often misdiagnosed or overlooked by healthcare providers. Many individuals endure years of uncertainty and frustration before receiving a definitive diagnosis, during which time their symptoms may worsen and their quality of life may deteriorate. The hallmark symptom of chronic fatigue syndrome is profound fatigue that lasts for more than 6 months and does not improve with rest. This fatigue significantly impacts daily activities and may worsen with physical or mental exertion, a phenomenon known as post-exertional malaise. Other common symptoms include unrefreshing sleep, cognitive difficulties, often referred to as brain fog, muscle and joint pain, headaches, sore throat, and tender lymph nodes. The severity and combination of symptoms can vary widely among individuals, making diagnosis challenging. The exact cause of chronic fatigue syndrome remains unknown, and it is likely that multiple factors contribute to its development. Researchers have explored various hypotheses, including viral infections, immune dysfunction, hormonal imbalances, genetic predisposition, and psychological factors such as stress or trauma. Some studies suggest that chronic fatigue syndrome may result from an unregulated immune response following an infection, while others point to abnormalities in the central nervous system. Additionally, environmental factors and lifestyle choices may play a role in triggering or exacerbating symptoms. Diagnosing chronic fatigue syndrome can be challenging due to the absence of specific laboratory tests or biomarkers. Instead, healthcare providers rely on a thorough medical history, physical examination, and exclusion of other medical conditions that could cause similar symptoms. The diagnostic criteria established by the Institute of Medicine and the Centers for Disease Control and Prevention include the presence of debilitating fatigue lasting for at least 6 months, along with specific accompanying symptoms. Managing chronic fatigue syndrome requires a comprehensive approach tailored to each individual's needs and symptoms. There is no one-size-fits-all treatment, and strategies often focus on symptom relief and improving quality of life. Lifestyle modifications, such as pacing activities, maintaining a consistent sleep schedule, and avoiding overexertion, can help manage fatigue and prevent symptom flare-ups. Cognitive behavioral therapy and graded exercise therapy may be beneficial for some patients in addressing the psychological and physical aspects of the condition, although their efficacy remains a topic of debate. In addition to lifestyle adjustments and psychological interventions, pharmacological treatments may be prescribed to alleviate specific symptoms associated with chronic fatigue syndrome. These may include pain relievers for muscle and joint pain, sleep aids for insomnia or disrupted sleep patterns, and medications to manage other coexisting conditions such as depression or anxiety. It's essential for patients to work closely with their healthcare providers to develop a personalized treatment plan that addresses their unique needs and concerns. One of the most effective strategies for managing chronic fatigue syndrome involves a multidisciplinary approach that addresses the various aspects of the condition. This may include collaboration between primary care physicians, psychologists or psychiatrists, physical therapists, and other healthcare professionals. A team-based approach allows for comprehensive assessment, personalized treatment plans, and ongoing support tailored to the individual needs of each patient. Managing the symptoms associated with chronic fatigue syndrome is a crucial aspect of treatment. Medications may be prescribed to alleviate specific symptoms, such as pain, sleep disturbances, or cognitive difficulties. Non-steroidal anti-inflammatory drugs, Tylenol, or opioids may be used to manage pain, while sleep aids or medications targeting sleep disturbances may improve sleep quality. Cognitive enhancers or antidepressants may be prescribed to address cognitive dysfunction or mood disturbances. Making lifestyle modifications can play a significant role in managing chronic fatigue syndrome symptoms and improving overall well-being. Pacing activities or breaking tasks into manageable segments with rest periods in between can help conserve energy and prevent symptom exacerbation. Establishing a regular sleep schedule, practicing good sleep hygiene, and avoiding caffeine, alcohol, and stimulating activities before bedtime can promote restful sleep. Maintaining a balanced diet, staying hydrated, and incorporating gentle exercise, such as yoga or walking into daily routines, may also be beneficial. One strategy that's been shown to help with chronic fatigue is graded exercise therapy. This is a structured exercise program that gradually increases physical activity levels over time. It aims to improve physical function, reduce fatigue, and increase tolerance to exercise without exacerbating symptoms. Graded exercise therapy typically involves working with a physical therapist or exercise physiologist to develop an individualized exercise plan tailored to the patient's abilities and limitations. The program may start with gentle stretching or aerobic exercises and progress gradually based on the patient's response. Mind-body techniques such as relaxation exercises, meditation, mindfulness-based stress reduction, and biofeedback may help reduce stress levels, alleviate muscle tension, and promote relaxation. These techniques can complement other treatment modalities by promoting overall well-being and enhancing the body's ability to cope with symptoms. Integrating mind-body practices into daily routines can empower individuals with chronic fatigue syndrome to manage stress more effectively and improve their resilience in the face of challenges. In addition to medical and psychological interventions, supportive therapies such as massage therapy, acupuncture, chiropractic care, and hydrotherapy may offer relief from chronic fatigue syndrome symptoms for some individuals. These complementary and alternative therapies aim to address underlying imbalances in the body, promote relaxation, and improve overall physical and mental well-being. While evidence supporting the efficacy of these therapies in chronic fatigue syndrome is limited, some patients may find them helpful as part of a holistic treatment approach. Managing chronic fatigue syndrome requires a comprehensive and multidimensional approach that addresses the physical, psychological, and social aspects of the condition. By combining symptom management strategies, lifestyle modifications, psychological interventions, and supportive therapies, individuals with chronic fatigue syndrome can enhance their quality of life and regain a sense of control over their health. Working closely with healthcare providers and adopting a proactive approach to self-care are essential components of effective CFS treatment. Through continued research, education, and support, we can strive to improve outcomes and empower individuals affected by this challenging condition.